the Pawsit podcast. I am Dr. Sam. With me is Dr. Robert. How are you?
Hey, Dr. Sam, how you do today?
I am good. I like that you're back in your studio and
Yes,
I see something furry behind you. What's that?
I have my new friends here. This is my cat colony that I've created. No, I'm
I
just
love
kidding.
it.
No, I know there's a lot of new friends in here. I decided to participate in the podcast back where I belong and have them involved. So here it is. It's been a great week. Actually, they're really easy to get along with. So, yeah, I've got a whole bunch of new friends. You see them walk around periodically to the camera. So enjoy.
I love it. Well, when they come through, you got to tell us who they are. If you remember
I
their names. There's a lot of them, so I think you're still getting to know some of them too,
I have
right?
to get no. I think I have a pretty good knowledge base of most of them. Every once in a while, like there's like five white cats, and two are long hair, three are short hair, or I think yeah. So it's like I got to see which one's eyes look this way and certain things. So
I was gonna ask, like, do they have like defining features that you can at least be like, oh, that one has a spot on his ear, so that's
a few of
Joe.
them do. Like some have like the two white cats that look very close up besides like a tail difference. So I had to like actually like grab them, and be like, all right, who are you? So it's fun.
Do they have very different personalities, or are they all like, can you kind of see similarities
They're
between
very
them?
different. Like the reason why I couldn't do the podcast back here originally is because of Wizard.
Mm.
He's this all black cat, one of my favorites, but also he's like if Dennis the Menace was a cat, this is that cat.
Yeah.
Uh, just built for chaos. Like I built this beautiful gate. Or I didn't build it. I bought a beautiful gate to keep them in their zone, so nice and safe from the dogs, so they have privacy. And there's like maybe a foot of room at the top. This is like a 6 foot gate, so it's a decent
Hmm.
sized gate. He didn't touch it the entire like couple days, but then we actually put like this cat box out in front of it, and he decided he can hop on that and then jump over. So we're
Oh.
like, all right, it's the only problem. So we removed that, so we got out of the way. And now he just knows he can jump over, so he just clears it now on his own. So I'd like put up like a bunch of things up top. Then he got through those, and I put soap on the top so he'd slip off. And then like it's like this cat would not stop, and he was just determined to beat me. And finally, I have him now, but it took a while.
he was outsmarting you at every turn.
He really felt like I was being schooled by a cat, and it was
He's like, I'll do whatever I want.
yeah.
Let's just get this clear.
He was a very cocky about it because he walked down the hallway afterwards like I own the place. And I'm just
Yeah.
like,
Did
why would
Loki even care?
Loki wants to meet him? I think the cat has or Wizard has some good sense to him. And I was like, I should take it slow, get the big dog, and go from there. So they'll slowly be introduced as time goes on, but I'll make sure they're comfortable here first before we get too crazy.
Yeah, yeah, yeah. Okay, I didn't know if like Loki was like, "What's happening?" I want to know what's happening.
Well, it's funny because like I used to feed him by their gate, and so he was okay with it initially, but all of a sudden now he's got like 16 cats meowing at him while he's eating because they're hungry too. And
Uh-huh.
he gets self conscious because he leaves. Now he's just like, I don't want to eat back here because
He's like, I
all these
just
cats like,
don't. This
oh,
isn't what
okay.
I want.
So super fun. So it's a learning experience for all of us.
Oh my gosh, yeah. I think one day we're gonna have to dedicate a podcast just like all of them and like what it takes to take care of them because I think it's important to know like that's a totally different thing than just having like one cat or two cats or you know what I mean? Like that's a totally different thing.
I can have a guest host as Lexi, her their owner, so we can
Yeah,
throw
that's great.
her. So she
You
did
know how
this to
much
me.
we love
I'm
guests.
going to bring her into this. All right. So payback. But yes, it's guys.
Well, so today we're talking about something not at all inspired by your by your situation, but I suppose in some ways you could see something like we're talking about bite wounds, right?
Yep.
So sometimes we'll have cat dog interaction, sometimes we'll have dog interaction, sometimes cat interaction, sometimes animal and unknown. And so it's always good to kind of have a conversation about, well, what do owners do? What do we recommend? What do we see? And how they can present. I think those are all some pretty important things we can cover.
Yeah, and I think it's kind of interesting that you bring up like the different interactions because you can kind of tell which animal caused the problem based on where they're bitten or scratched.
Mm-hmm. And what did
And
they look like, really? Like punctures
yeah,
versus shear versus, you know what I mean?
absolutely. It's kind of funny because I didn't think about it till just now. But I'm like, yeah, you get a pretty good idea of like who did the damage just based on that, like corneal ulcers or scratches. Most times there's a cat involved
Mm-hmm.
because
Oh
it's
yeah.
always like an NG too that's like got too close to a cat.
It's like I don't know what to do with my eyes.
Exactly. It's got too
Yeah,
close for too
they're
close.
sticking out too far.
It's always a Frenchie. Why?
You know the craziest thing though, you saw talk about like corneal ulcers. I one time saw, so an owner brought a cat in to me that had gotten into a fight with one of the other cats. And she
Okay.
was like, I mean, this cat was just like squint, I mean, could barely open its eye. And I was like, oh, that looks really bad, you know? Um, and just because I have seen some weird things,
Hmm.
I'll like, numb the eye, obviously, I'll stain it looking for a corneal ulcer, but I have gotten into the habit now of going under the third eyelid, pulling it away, and making sure there's nothing there, because you miss a lot if you don't do that. And
Yeah.
there was an entire nail.
Oh, damn,
Yeah,
that sounds.
an entire, like, you know how cats can just like their whole nail,
Oh
and
yeah.
I mean the whole nail, and it was sharp. And I was like, oh my gosh, this never would have healed if I didn't like pull
Oh
this
no.
out. And this cat, when I tell you like relief is not even a word. Like he was so happy that that was out of his eye. You
He's like,
know,
thank you so much.
he's like, "Oh, I love you so much. Thank you." Like,
Oh, that's
yeah.
always the worst. Like we pulled a couple foxtails out of a couple cats' eyes this past week, and they're just like
Oh, were they in the
their
medial
eyes.
canthus? We're like right here.
They were yeah underneath the medial canthus, third eyelid area.
Mm-hmm.
Like just buried in there. But like you feel it's like you can almost tell when they're that bad because they literally can't open their eye at all
Yeah.
because it hurts so bad. And I'm just like, you feel bad because they can't take it out themselves.
Yeah, I think the two worst, because I see corneal ulcers all the time and like for lots of different reasons. I mean, trauma being one of them. And that's definitely something that you need to take into account. Like if you have a pet that's been in a fight, you know, and they're squinting at all or anything, I mean, you definitely have to have their eyes checked. No question, because those can go from bad to horrifically bad to loss of an eye very
Yeah,
quickly. But I think the two worst ocular injuries I've ever seen is that one. I mean, like where I mean that cat
yeah,
was so painful. It was clear there was a foreign object there. And then
yeah.
the other one was a retrobulbar abscess. Because
Uh,
that dog, what I have, that dog was in an enormous amount of pain. Just a
but
shocking amount of pain.
have you ever fixed them yourself, where you kind of go through the soft palate with a needle and draw out the
I have never, I've only had two retrobulbar abscesses,
my
and the first one was not, didn't present in a very obvious sort of a way. And so it wasn't until like we it came back on a recheck, and I mean I couldn't even touch this dog, and it was like one of those situations where it was not appropriate for me to be like we referred it, you know what I mean? And then the dog ended up actually having to have an enucleation, because and I can do an enucleation, but I mean it was just the situation. I think it was like a timing thing, like it was like the end of the
wow,
day, and it was, you know what I mean? And you know, at some point you gotta just kind of call it. And um I don't remember the exact situation of it, but yeah, that dog was in an enormous amount of pain.
yeah,
I think it was just like too late in the day for us to be
do
doing
anything about it.
anything. But I did read about that, because then I had a cat that had what I was thought was a retrobulbar abscess, but the cat, it was draining, like it had a draining tract somewhere, and so
Yeah,
we were
sometimes they'll
able.
start draining, which is nice, but
Yeah.
uh, it still hurts like hell. So.
Wait, so have you ever done that where you've gone up and drained it that way?
I've seen the ophthalmologist do it. So, like sometimes the ophthalmologist will handle it versus ourselves.
Mm-hmm.
'Cause I don't know exactly what the problem is, although like you have a good idea of it. So CT it first, and
Yeah, but
well
I don't
done.
have a CT, and that's the other thing too, is like just because I think that's what's happening. Like with the cat that I had it with, the person, he didn't have any money, so it was whatever I could do is what was going to happen. And so
Gotcha. That's fair. And I think we see a lot of the older patients that are like, is it a mass or is it a
yeah,
abscess? If it was a younger patient, I'd probably go for it. Just like, hey, just put a little needle back there. If it comes out with pus, you're gonna relieve the issue and put my antibiotics. But yeah, yeah, a couple of things like that. But we'll get into those things later. So
yeah,
super fun.
yeah. No, I guess I read about it, but I was like, ooh, I don't know. What if I perforated an eye? I don't. I mean, maybe it's for the, maybe there's a good enough landmark. I no, I've never done it, so
No,
I'd really have to read about it, and it would have to be one of those situations where I was their only hope. Like, you know
and
what I
it's
mean?
like,
Like I
yeah,
was
this
their Obi-Wan. Like, no, like that's
I'm their Obi-Wan.
yes,
There you
exactly. Like that, because if there is something that I should not be doing that somebody else can do better, I will be 100% upfront with people and be like, I've never done this before. Like I just had a dog the other day. This is totally like off the subject, but he was starting to get a cherry eye. And I was talking to them about that. And it was like really just starting to prolapse. And I
go.
was like, ooh, I was like, this is probably going to end up being like, it was a Great Dane, you know, I was like, this is going to end up being a full cherry eye pretty soon. But we talked about it, and I was like, I mean, there's a surgery. I've never done it. So you should go to somebody who does it every day if you want it to be successful. I mean, honestly, you know, now would I ever try it? I mean, if they were literally like, it's that or cut the third eyelid out, well, then I would do that. You know what I'm saying?
Yeah, I do this. Yeah, I agree wholeheartedly. I would do the same thing.
Yeah.
So, when there's no other choice, it's nice to be like, hey, I'll give you an option. It may not be the best option, but it's better than no
But I
option.
will be 100% obvious. I will be like, I have
Yeah.
never done this before, but if this is your last chance, then I'll at least try, you know.
Yeah. Yep. Absolutely.
And then I
So
won't sleep that night, but you know,
that
I'll
part's
just worry about it the whole night.
that's it's so true. They're just like, I don't know how this patient's gonna do, and then you call them like 2 weeks later, and like, yeah, it's just fine.
Everything's
They're
great.
amazing.
And you're like, well, I'm glad I didn't sleep for 2 weeks. Thanks.
Animals are amazingly resilient. That's the one thing we'll come away with. They're just very resilient in most
and
cases.
and cats being one of the most resilient of all of them. Like like they break a bone and you just like get them in the same room. They'll
Yep.
heal.
Yeah. It's it's crazy. They're quite incredible, all of
Yeah,
them.
they're
So
pretty magical actually. Now you've got a few of them to really
experience
know.
exactly. So I told her if we break up, I had to keep having them, so it's fine. So and then she shot me a death glare, so that worked out really well.
She was like, no.
No.
um, but so I think with cat interactions, I think for me what I see the most in my practice is cats that are indoor outdoor and they come
Yeah.
back, and usually it's like either the owner's coming to me because they're like, there's something, it's huge and it's oozing, and they're like, and it's weird because they didn't eat for 2 days and then now they feel better, but they're, you know, it's like, well, they had a cat bite abscess.
Yep.
And
Exactly.
that's what's happening. Or sometimes there is like those situations where it's like an indoor outdoor cat and like they're punky and the owner doesn't know why. They're like they haven't eaten in a couple of days and they seem really weird, and I think they hurt their arm or they hurt their leg or something like that, and then you feel it and you're like, oh no, that's an
Answers.
abscess. They have a 104 fever or 105 fever, and they're, you know,
But
that's why they're punky. And so yeah, you lance that thing and they feel much better.
that's actually honestly 95% of them. Like they're always like becoming as abscesses a couple days later because you don't see the initial insult, and it's
Oh, that
always
happens sometimes too, actually, to us also.
yeah, it's always like on a limb or it's on their butt. Sometimes around the side of their necks too.
Their neck, yeah.
But it's just kind of funny how they're very consistent where they attack, where like dogs or even wild animals, they're
Mm-hmm.
like for the throat half the time. It's terrible. And the ears. And the ears. Why always the ears?
Probably just because what they can grab, you know what I
And
mean?
you know, it's like, ugh, they're so nice.
But I have a question for you. So being that you do emergency and you probably see some of these interactions and stuff like that, when do you do rabies vaccines? Like, do you update rabies vaccines for those guys that
You
get?
should. We usually tell them to go to the primary vet afterwards because we try and
Oh,
keep a good relationship with our vets, and that way, no, like we don't want to take away business from them. So we're like, hey, go get your rabies vaccine again to booster it. At the same time, make sure everything looks okay. So doing like 2 to 3 days and get it done.
oh, okay. Yeah, I was wondering because I was like, I mean, I feel like that was something that you just might have to have on hand. Like, do you guys have rabies vaccines just in case?
We do, but they're more for like clinic personnel for like their own pets. But I think we also should start doing it more at the time of the incident because how many owners actually follow up afterwards? Who knows?
I think it
Uh,
really just depends on the owner, right? I mean, like I think but a lot of people, what I notice, like a lot of people don't even really know when their dogs last had a rabies vaccine. And so
yeah,
if you don't even know in your position, if you don't have access to their medical records, which I mean, most
I
people
never do.
don't have those.
Yeah,
So you wouldn't even know to give them a 3 year versus a 1 year rabies, right? I mean, like if you have no proof of it, technically it's only a 1 year rabies, even though it's the
yeah,
same disease.
exactly. That's the tough part a little bit because you don't know like their status on things, and I don't know. It makes it easier to. That's why we should just give it in house because I feel like it's like making them spend more money by saying, "Hey, now go make another appointment with your vet," and
Mm-hmm.
then I seen there where I'm like, I'm already doing all the things. I can give them a quick injection while they're not going to feel it and
Right.
get it out of the way. But
Yeah. Although if they were coming to my clinic, I believe that we wouldn't. Well, it depends on it. If we were doing a recheck exam, then obviously they'd get charged an exam, but if not, like we might just re up their vaccine and just be like, go. You know what I
not
mean?
really. That's nice.
Well,
That's the
if you guys had done everything and we we knew like you they were already taken care of and like they've just spent however like we would just be like yeah just we'll do a quick walk and back we'll just update it I'll take a look at it and I'll just send you on your way. Yeah,
cool.
we're
That's
nice
cool.
like that. We try to be nice.
You guys are nice. That's why I like working with you. One day I'd like to work with you in a professional manner, but I don't think it'll happen, at least in a veterinary standards. So
Yeah, I know. We'd have to be in the same city. We'll have to just work that out one day.
you can move to California anytime you like. So
I know that's probably not going to happen though. We're just going to have to pull you guys back this way.
yeah,
It'll be a coast. We'll have to just pick a coast.
you have a better chance on the coast, if anything. So
East Coast.
maybe East
No,
Coast, cheaper
I love the
coast.
West Coast. I'm not saying anything bad. I just
No,
probably yeah.
it's
I'm from the
a
East
big.
Coast originally, you know what I mean? So,
Well, my family wouldn't mind having me back closer, but in the meantime, I'm very content here. So
yeah, yeah. Well, I mean, you are in an awesome place, so we'll just have to at
that
least come out and visit anyway.
plus the cats are now comfortable, so now I can't leave. I'm just stuck
Yes.
here.
Well, now you're stuck forever.
Okay. They
Although
live here.
these cats we've already said they're happy anywhere, so
They're happy anywhere. They
they
could be
can
East
pick
Coast.
up and go. You know, you just give
Yeah,
them more space. You were, if you're not in California, you have a lot more space.
that's true. I think I can make this like a homeward bound episode, like all traveling across the country, like all the
There you
cats,
go.
individual stories.
Tell the
Yeah,
story of each cat. You could do it.
exactly. Just write a novel would be great.
Exactly.
Oh man,
But so
I dig.
when you treat a cat bite abscess, so then what do you do? Do you just flush it, antibiotics, pain
Yeah,
meds?
always Lancet. Lancet's the first thing. So usually
Yeah.
pain meds, Lancet, and then flush the hell out of it because
Yep.
that make it feel better. And most of the time that's enough. But yeah, we give them antibiotics to go home with because usually their fever is, like you said, 104,
Hmm.
105. Just how bad they are.
Yeah.
Bites are nasty for people too. Like
Oh
just like
yeah. Oh
if
yeah.
you get bit by a cat, like do take it seriously. The number of technicians I've seen that need like have gotten bit on a nerve that messes up their hand. They can't feel part of their hand afterwards. Like
Well, I think
it is.
actually we were gonna try to see if we could get my sister to come on here. She's a human doctor and she can talk more because she does urgent care too.
In my
So we'll
case,
see.
I'm gonna keep my mouth shut then because I'd like to have her like input on that
Yeah.
because I've seen the technicians come back and obviously the other doctors, but technicians
Hmm.
handle more patients.
Yeah.
Just go rough.
Oh
So
yeah, no, I know. And sometimes it is like you're like, oh, I don't want to go to urgent care again, but you really you need to get them taken care of. But that's the other thing too, like going back to the animals, when they bite each other, when they have a problem, like I have definitely seen people be like, "Oh, my dog got into a dog fight and they didn't do anything about it." And then 3 days later they're like, looks bad." And it's like, "Yeah, that's because there I think for some people there's a misconception that dogs have clean mouths. They don't.
they lick their own ass, guys. Like, come
Yeah,
on.
no, they eat actual feces. Like
Yeah.
don't have clean mouths. And neither do cats. They have a lot of bacteria in their mouths.
Yeah.
And I mean, so do we. Look what we learned. And we don't eat feces. And think about how much bacteria we have in our mouths. Like if a human bit you, you should go get antibiotics.
Yeah.
The takeaway today is nobody's mouth is clean. Human, animal, wild animal, whatever. Like you need to have it looked at. And I have seen so many ignored animal bite wounds that have become festering, disgusting things that could have been avoided. And the other thing, the biggest mistake that I think that I see on a regular basis is when um whomever is treating a dog bite wound closes them.
Oh, without a
And
drain.
yes, without a drain. I sometimes yes. I mean, sometimes they are so extreme that they do need to be closed. They do, but the worst thing you can do is just take an infected, like by just if you get bit by a dog, it's infected.
Yep.
So but the one clinic that is near me, they do a good job of culturing it,
Yeah.
you know, cleaning it and then closing it. But those will still a lot of times they'll get infected, but they
Yeah.
do put a drain in them, thankfully. So that doesn't that's good. You need to that
Yeah,
needs
the
to
drain
be.
definitely helps. And I always tell owners the same three things with all bite wounds of any kind. Doesn't matter who it's coming from. It can get infected no matter what we do. It doesn't matter if it's on antibiotics, we flush it out, it looks beautiful, still get infected.
Mm-hmm.
So keep an eye on it. two wounds are a lot like icebergs, where it may not look so bad on the surface, but once we get underneath there, you can see a whole bunch of damage that you didn't realize was there, and the plan can change.
Mm-hmm.
And finally, last thing is, don't blame me when it falls apart because a lot of times the damage is so bad they get crush injuries where the cells themselves just haven't realized they've died yet,
Yeah.
and
Oh yeah.
you make them look all pretty, and then 3 days later, the owner comes back in being like, "It fell apart. I want that doctor's name. He did a shitty job." It's like, no, it's not my fault. I
Mm-hmm.
tried.
Yeah.
It's just skin.
Pressure, pressure, and shear. Like those are two big things. And so, like you said, like crushing wounds, yeah, they don't present themselves for a little while. I'd say
Yeah,
trauma in general, right? I mean, like it usually takes like 24 to 72 hours to fully see what you are dealing with, which
absolutely.
is why I actually don't think it's wrong, truthfully, to in appropriate cases clean a wound
Yeah,
and manage it open for 3 days. Let it do its thing. If you are in a situation where you can do that, and then after delayed closure, I mean, you could do a delayed closure after that, because then at least you're closing it once it's already clean, once it's already like presented itself and it's done its thing.
yeah, I agree. I think that's a really, especially if an owner is financial to any extreme, and they can't afford like two consecutive procedures to
Right.
like first time you fix it and the second time.
Mm-hmm.
The first time I would just honestly put some sutures in it to like not close it, but to keep it together a little more, so you don't worry about like those.
100%. I mean, you can definitely do some stuff to support the wound. You can
Yeah,
do stuff to keep it so that it doesn't have to heal from this big, can heal from that big. Absolutely. But I do think one of the biggest mistakes is people thinking like, "Oh, we cleaned it. It looks good. We can close it."
I 100% agree. Like that's probably one of the bigger
Yeah.
mistakes. People close them up like, oh, it looks fine. Now I was like, it doesn't look fine. It's
Yeah.
got some issues. So,
And it's like and if you explain to people like, okay, see all that tissue there, that's probably gonna die, and then eventually we'll come in and we'll do. Okay, I mean, I suppose you could also go about it that way too, but
yeah,
a lot of times people don't. I don't think that the expectations are set as far as like what can happen. It sounds like you have that conversation, like you really do say like, hey, these are the things that I don't know yet, and so and I will be honest with you. I mean, I think sometimes I've said that to people, like I've laid out like this is what's going, like this could be a month before this is done, because some of this I don't even know what we're dealing with yet, and then they act like I never told them
I
that, and
think
I'm
they're
just like,
flexible.
well, I
I think
definitely did.
one thing you point to, like the length of time. I don't think
Mm,
people understand. Like some of these, it's not so much cat bites. It's like cat bites. They're usually just like a local bad abscess. You
yeah.
fix it, fine. Like there's usually no long term damage. They're
No,
pretty nice.
cats. Yeah, like a cat bite abscess on another cat. Cats
Yeah,
heal. They're magic. Once you get it cleaned up, they're like, oh, 2 weeks later, you're like, oh, look, it's like nothing ever happened.
they're perfectly fine.
Yeah.
Dog on dog or dog on cat, different story. And I think that's where the longevity thing comes a little bit into it because they cause damage. Like it's giant holes. Sometimes it's into body cavities, which is worse.
Oh yeah.
Uh, that requires like a surgery to go in, make sure nothing was perforated in the small
Oh yeah.
intestines.
Oh yeah.
But I think I love to hear what you tell owners about in terms of length of time because I think that's a big thing that people don't understand.
I think it depends on the severity of the bite, but I do think like one of the biggest things to understand about the way dogs bite and the way cats bite like, you know what I mean? Like it's like a needle, like they're, you know, but dogs, they tear and they shake. And so a lot of times what happens with dogs is you'll get like a physiologic degloving, like where two parts of like the skin are they're not attached to each other anymore. So like sometimes like the skin will be there, but if you see like they have a wound and then if you stick something in, I mean it tunnels, it go, you know what I mean? So there's so much of it that there's just so much area and potential space for infection to happen. And then sometimes like you said, if that skin just like doesn't survive, then
Yeah,
you know what I mean? And then you're dealing with it. So with a big open wound, I mean that those I mean depends on how big they are and how infected they are and how much reconstruction needs to be done, but
mm,
most of the time it's going to be at least a month, and they need to know like they're coming back for like serial bandage changes or wound cleanings. And I mean, thankfully in some places you don't always need to sedate them, depending on
yeah,
where the wound is, depending on, because the deeper the wound too, a lot of times like all the nerve endings are they're gone in that area, so actually you really can actually clean it pretty well and do a lot of stuff except for on the periphery of it that they're like, oh, whatever. Like they don't really care.
Yeah, I agree. I think that's kind of the nice thing. Like, it's I don't know if they're just numb from, like you said, maybe the nerves are just ripped off
They
entirely,
are. I
or
mean, all the superficial nerves are gone. So,
you
and
do a
at
lot
that
more.
granulation tissue coming in, it's not pain. You could mess with it. It's not painful.
Yeah, so like later on in the wound care, it's much easier just to clean
Hmm.
things up easily as long as it's not like a young puppy bouncing around.
Well,
But for the most
sometimes
part,
you can like even just depending on the dog, but I do feel like this happens to old dogs all the time, right? Like it's always the old dogs that they're like calm and like they'll just kind of sit there and let you do it, and it's sort of
they're
sad.
such good dogs. You feel so bad, like the old
I
man that got
know.
work, and you're just like, I'm sorry, dude. Like, and you're just like, just fix me. Ah,
Yeah, exactly. And so usually the trick is make sure their pain is just overall managed because they will not heal well if their pain is not managed.
yeah.
Um, I don't like the old school idea of like, oh, well, if they feel pain, they're not going to move. It's like, no, no, no. Manage their pain and give them sedatives if you don't want them to move. Like,
Yeah, that if they're painful, they won't move. This the complete opposite. I feel like one dog you touch them, they're like, ah!
yeah,
And I
no,
forget.
that's the old school idea of like why they didn't used to give robust pain management to. Oh, the sad part is this is actually also what people used to think about. Like they used to think that babies couldn't feel pain the same way as
Oh,
adults. Hi, kitty.
Hunter.
But yeah, no, my mom, she does a lot of surgery on babies because she's a plastic surgeon, and the old ideas about like whether or not infants could feel pain the same way as adults was that like they couldn't.
I did not know. That's horrifying.
Yeah, so like a lot of times like they'd be like, well, we don't know why the baby's not eating. And I was like, they're painful. Treat their pain and they'll eat.
That's so crazy. That's okay. Well, good to know.
I mean, not now. This is like this is I mean, she's been a doctor
No,
for
it's just
a
funny how
long
like far
time. So we're
it's
talking.
like how far medicine's coming. It's kind of like when
Yeah.
owners their dog is limping and they're like, oh, they're not painful. I'm like, by limping, your dog is inherently
Yes,
painful.
that is what they're telling you. They are painful. Yeah.
Every time it's like, oh, they're not painful. I'm like, he's limping. What else do
Yeah.
you want him to tell you?
Yeah.
Hold the sign that says I'm hurting.
Yeah. Oh, and going back to the like limping dog. So like sometimes when they get, a bite on their arm or something like that, do not wrap their arm. Like I have also seen that, like where they're like, oh, they were bleeding, so I wrapped it. It's like, oh, so we took an infected wound that we didn't have checked. And then we wrapped it and caused pressure necrosis. And now we have a bigger problem, And the thing is, it's hard because it's like it's all well intended, right? Like it's all like they're just trying to help. They're trying to do what they think. Oh, that's the other thing. Some of the biggest mistakes that I've seen with like home wound care management. So wrapping it, most people wrap it too tight and they cause pressure necrosis and they cause real problems. So unless you
Yep.
actually know how to wrap something, do not wrap it. Put an e-collar on your dog and put them in a room with a towel until you can have them seen or whatever. You know what I mean? If you're worried about a little bit of blood, as long as they're not bleeding out, in which case they need to just go right to the doctor. But if you're taking them in the next day, let's say, if you want to clean it out, exactly one time you may clean it out with hydrogen peroxide. Then don't
One
ever
time.
use hydrogen peroxide again.
Yeah, I agree. Because and
Ever.
why is that, Sam? Tell them why that is.
It will destroy it is cytotoxic. It will kill the skin cells. Like after a while, it will inhibit healing and it will not help. So don't
Yes,
do it.
exactly. Yeah, kill the ones that are trying to come back and heal.
Yeah.
So don't. Uh,
Yes. It's
but yeah,
the opposite of what we want to do. And I have seen one time
oh
an
god.
owner use rubbing alcohol,
Oh man, that hurts so bad.
but not just one time, serially.
Oh,
To the
what a
point where by the time I saw the abscess, it had become a burn. So don't do that either.
what I don't understand. Okay, so word of advice for all owners: if your pet got bit and you're worried about it in any way capacity, bring them in just for a quick look. A lot of times, I will triage you away and say, hey, your cat or dog will be fine. Like
Yeah.
you can shit up at home, you'll be fine. Like it's not a big deal.
Hmm.
If it is like serious, then we can talk about it. But just talk to your vet for 2 seconds. I had an owner call last week. This is my mini vet session. Um, there's a pet sitter and they gave the medication twice, but she's like, well, I want to call and see if it'd be okay. I was like, why did you get the second time before calling? Why not call after you gave the first dose? The pet had vomited,
Hmm.
and then they gave a second dose right afterwards, and then called to see if it was okay. I was like, all in between, so I can fix it if you shouldn't give the second dose.
Right.
Just
Yeah.
stuff like that. So just call or bring them in for. Let's say we don't want to do the work. Honestly, like if it doesn't need our attention, I will send you away so quickly. Trust me, it's an ER thing. Promise you. So the same
Oh no,
paperwork.
no, it's not just ER.
It's a veterinarian thing. If we don't need to see you, we will send you home. Trust me.
It's true. No, and like, and the thing is, especially if you have a relationship with like your GP, like me, send an email. I mean, I will often be like, take a picture. Let me see if I can tell you based on the picture that they need something. Guy had a dog the other day that had gotten into a dog fight and just had some wounds on the nose, just not right on the nose. And I could like they sent me a beautiful picture, and I was in the weeds a little bit, and I was like, you know what, like. Is that the only thing the dog has? Like it was a pretty straightforward, and they were like, "Yeah, there's nothing else." And I was like, "I'll just fill some antibiotics for him. It's fine. We've seen him recently." You know, in a perfect world, yes, it's not my. I would like to see it, get my hands on it, but I think they were actually away somewhere. I think they were like in another state. And I was like, I'll just find out the nearest whatever and I'll call out meds and save them a, emergency room.
Yeah, it's like we try and help out where we can because it saves us some paperwork and it makes it easier on you guys. So it's
Oh,
just
yeah. And
ask.
if I can do it and it's reasonable, you
Yeah,
know what I mean? Like the dog was like happy eating, doing its thing. He just like had a little wound on his nose. And instead of it getting infected, I just like, no, let's just call it a broad spectrum antibiotic, call it a day.
yeah. So the dogs feel pretty well too, especially if it's like depends on whether I think the ear wound's the worst because you got to deal with the cartilage and it always goes through and it's just
Yeah, and like the thing is if they get an oral hematoma or if they, what I mean, they're just gonna get scarring or it's gonna bleed a lot, and they just take a
yeah,
long time to heal sometimes. Um, so yeah, those can be kind of wicked because they're not very easy. That and like if they shear a paw pad or something like that, so those are just because you can't. They're just so hard to
awkward
reattach,
locations.
and then yeah, exactly. So awkward locations are hard, but I think too, as far as like things you can do at home for me, I instead of even like trying to pour hydrogen peroxide on it, I mean, if it's a situation or a place that's appropriate, so I mean, if you think your dog got like into a body cavity, I mean, don't try to do anything yourself. I'm talking about like if they have a bite wound on their arm and you're gonna wait to the next day to bring them to the vet. If you have a shower with like a shower head, lukewarm water flush, dilution
Wonders.
is the solution to pollution. Go ahead and get in there.
I was waiting for it. I was like, I know she said this in the past. So. Was that a Stanley thing?
It's my fit. Yeah.
That was okay. That's why.
Yeah. It's one of my favorite. But the thing is it's great because then you just pat it dry and then again, don't feel like you have to wrap it. E-collar. Just keep them from making it worse and get them to the vet.
Yeah, I think that's a good couple steps. Like, if you're at home, your pet gets bitten, one, flush it out. So, like I
Yeah.
said, just I think it's a great example. Just use some lukewarm water, wash it out. You can put a soft bandage on it. Do not wrap it too tight if you feel comfortable with it. But if you don't, then don't touch it at all and just put the e-collar on it because bandages cause more problems than most.
Oh
And
my
then,
gosh. Yes, they do. I had to take off an entire tail because
oh,
somebody wrapped a tail and it was to the bone.
hey, okay, that's what you wrapping? Like, okay,
Oh,
that's
I've pulled duct tape off of legs. I've I'm telling you what, I don't wrap it. In my opinion, I'm gonna say don't wrap it. Just because I've just seen so many bad things. And like unless you're like a nurse or a doctor or somebody that
yeah,
like knows or like an athletic trainer and you know how to wrap something without causing a problem, I mean like I because I do think there's some people who have that knowledge obviously, um but yeah, just be really careful with that. I've just seen it be worse than better. Um
yeah,
and and then I think like, just don't wait until it festers. Don't wait until it gets bad. Go and have it checked. Get them on broad spectrum antibiotics. And, kind of hopefully you'll understand that like it will heal eventually, but they just, it might be a minute depending on how severe. And I've seen some really severe like probably the two most severe ones we saw in vet school were the Yorkie who lost his face. Do you remember that?
yeah. Oh, yeah, I remember. He had a whole bunch of plastic surgery done. Like, he
He
was, I mean,
did, yeah. I mean, he looked adorable after he was done, but literally I think a pit bull like took his face
yeah.
off through a fence.
He sounded like Frankenweenie afterwards a little bit for some time, but
He
he
did,
healed
but
up.
he was like he once his pain was managed. I mean, like he had no face, but he was like eating.
Yeah, he was. Oh, that's such a weird. It's been a long time since I thought about that
Yeah.
kid.
Oh, because I remember that was like they like reconstructed a nose, and I mean, by the end he was so cute. His little hair was growing in all different directions and stuff like that. He did great. Um, and then the one that I managed for almost all of soft tissue was dachshund that the a dog had taken off the back his back end. So,
Yeah.
but it was a physiologic degloving. Like it took a long time for it to fully present itself, and that
Mm.
dog was in that clinic. I mean, and that mom loved that dog. She came every day with. She would bring rotisserie chicken because he wouldn't eat anything else except the rotisserie chicken. The mom would come and she'd sit with him, and But I learned a lot about wounds from that dog, and I actually that was probably one of the first wounds I ever reconstructed.
Wow, nice. That's it's kind of cool that like remember those cases, kind of like where we were then and
Mm-hmm.
where we are. Just things
Mm-hmm.
have changed.
Oh,
But
I learned so much on that because it was, Dr. Stanley was like overseeing it. But then I
oh
was
yeah,
working with Dr. Gazzola. Do you remember her?
oh yeah, Gazelle. Yeah, I remember Gazelle.
She was great. She was really awesome. So I just I that was really like I learned a lot, and that owner was so dedicated and so wonderful, and that dog did great.
Yeah,
It took a
it's
while,
it's
but he
incredible
agreed.
that they can heal, like they can recover from these things. It's pretty awesome.
Mm-hmm.
It's takes a lot of time.
Yeah. And just if any vets out there don't want to manage their own wounds, send them to me.
Send to Dr. Sam in Indiana. She'll handle them all for you. Doesn't
I
matter
will
where you
just send them to me. I'll take them all. I literally, if I could like be in a van treating wounds all day long and doing nothing else, I would be happy.
go. I mean, Sam, I might have a job for you.
Yeah, I do. I love wounds. They're my favorite. Um, but that's the biggest thing. I mean, just I think the biggest takeaway from today is they're all infected. Treat them all as they're infected, and make sure that they get seen. Make sure that their pain gets managed, and make sure
yeah,
that you follow directions about how to have them rechecked, and understand that it's a process. If they do have a really bad infection, sometimes they can be extreme. The especially the dog bite wounds.
yeah, absolutely. I think that's a good summary of everything. Pay
Mm-hmm.
attention to things. So yeah, that's a wound. Enjoy,
Yeah.
guys.
Dog fights. But I
All
think
right.
we probably will follow up another time, maybe in a couple of weeks, where we can hopefully get a human doctor in. My thought was to see if we could talk a little bit about that, plus like maybe some other zoonotic stuff that we see
Yeah.
in humans and people.
You know
So
what? I'll just do a two-part series. She's there with you for the whole week. Just do you bring drinks. I'll
yes.
bring a drink.
Ooh, I like it. Okay. Yeah, exactly.
All of the Gallaghers are both yeah yeah. Last names Gallaghers. What's your sister's last
Well,
name now?
we were Gallagher's once upon a
You
time.
trying to say like the what's her last name?
Well, it's not that new. She's been married like
Oh,
20 years, but Nolting.
just kidding. Well, in that case, either way, let me keep the
You could call
sisters.
us the Gallagher girls. That's fine.
Gallagher Girls. It's the Gallagher Girls. It works. It's like a good podcast name.
Yeah.
So yeah, it'll be fun. I'm looking forward to it.
Yeah. Well, it'll be fun to have her on. Eventually, we'll have to pull her in, but hopefully, it'll be sooner rather than later. But this has been the Pawsit podcast. If you have any questions, you can always email us at podcast@mybalto.com. If you have any pictures of wounds that you want to show me, I'd love to see them. All that fun stuff. So, um, thank you everyone for listening and letting me talk about wounds for yet another podcast.
Suck that one in there. I see you. Hope you guys have a great day.